Okay, well, it's actually my privilege to introduce Mary Spring. As both a registered psychotherapist and a registered social worker at the Royal Victoria Regional Health Center, Mary is assisting children and youth who are experiencing acute mental health crisis. In addition to her work in the acute care setting, Mary is also part of a multidisciplinary team that works to address the educational and mental health needs of high school age children and students who have exhausted the resources at their local school. So today is also about profiling some services that are in communities, both regionally and in rural areas. So it's really lovely to be able to have Mary join us today. And as we noted that Dr. Montgomery was positioned in a field in rural Alberta, Mary too grew up in a field in rural Ontario, just 2 fields away from myself. So thanks so much for joining us today, Mary, and your leadership at RVH. Is
it okay if I use this up? Yeah? Awesome. Okay, I'm actually going to go this one. Good. Well, thank you so much, Michelle and Romp, for having me here today. I'm really excited to share with you guys a little bit about our Section 23 day program at RVH and give you an overview of the program in terms of how youth come to our program, how they move through our program, and then how they move often into the communities, reintegrate into the communities. Clearly, technology is not my strong. Today we're going to talk a little bit about a brief history of RVH in terms of their Regional Child and Youth Center that is inclusive of the RVH Day Treatment Classroom. Followed by an overview of child and youth services, the day program services, kind of giving you a detailed idea of what youth experience, and followed by some information about our unique programming, as well as what happens to youth post-discharge. Just out of curiosity, has anybody here worked with a rec therapist before? In any interdisciplinary teams? A couple? Shaking their heads? Okay. So today I'm going to share a little bit about our rec therapy program. Just being mindful, we have had the incredible experience of working with really talented rec therapists, so I'm not going to do it justice. But I just wanted to also acknowledge that our rec therapist plays such a pivotal role in the design and development of our program. Awesome. Thank you so much. Okay. So, as a brief history, RVH in 2017 achieved regional status for child and youth mental health, where we were able to open 3 unique units. One, our inpatient unit, which is an 8-bed facility, as well as our outpatient child psychiatry. It's changed names a couple times, however, has remained as outpatient psychiatry to date. And the program that I'm going to speak more specifically about today is the Section 23 day program, which is known across Simcoe County District School Board as Simcoe Academy. So we're a dually funded program that works in collaboration with Simcoe County District School Board as a Section 23 community treatment care classroom. So our program is a voluntary program in nature, so speaking very much to Dr. Hill and Dr. Montgomery's importance of a voluntary program and that motivation and readiness to change. Our program is voluntary for students that fall within a secondary classroom, so grade 9 to 12. In our program, it's integrative mental health and academic programming. So our inclusive team, our interprofessional team, is both a mental health and academic program. Both our mental health and educational programming is individualized and is based on the students' goals of what they want to work towards, both academically focused and mental health focused. Ultimately, the design of our classroom, with the understanding that Section 23 classrooms and how they're designated across the county are very specific to one treatment focus. And the treatment focus that we have kind of carved our piece of the pie is the mental health piece is anxiety and low mood. So essentially our program is designed to help youth choose some of the strong feelings that arise in regards to learning and within the school setting and at home, and find ways that we can practice skill and skill development in a somewhat of a natural setting. So we are located in RVH, which really isn't that much of a natural setting in terms of if we think of a high school environment. But we've been very fortunate to have 2 designated classroom areas and spaces that we try to make as much like a high school as possible. The other aspect about our program that's quite valued is we are able to have transportation provided by Simcoe County District School Board. So that has opened up possibilities for youth in rural areas to be able to come to RVH for the day and then return home for the evening and still access the same care regardless of where they live. The caveat to that is that it has to be within the Simcoe County District School Board lines. However, we have had youth that have accessed care farther north who have been able to provide families been able to provide transportation daily. Some of the logistics of our program, we have 2 consulting child psychiatrists that meet with youth on a bi-weekly basis with the treatment team, so taking into account all the different work that they've done throughout the week within the group setting and academics in order to inform their recovery and mental health journey. At present, we have a 10 student capacity, but with COVID, we currently have 6 based on our primary healthcare setting. When we start looking at criteria for the Child and Youth Mental Health Day program, we have both exclusionary and inclusionary criteria. For right now, in terms of the exclusionary criteria as listed above, the purpose being we often get questions about if this is a mental health classroom, how come there is exclusionary criteria? Our classroom very much focuses on quality of life and mood. Knowing that within Simcoe County there's other services that are that are designated specifically for other needs. So the inclusionary criteria for our program is specifically students in grade 9 to 12 within up to their 18th birthday who are exhibiting chronic or acute symptoms of anxiety and low mood. It's voluntary so that the youth is saying, hey, I want to make some changes in regards to school and mental health. Reside in the Simcoe County Muskoka region and have cognitive abilities above the 10th percentile. We have we're very fortunate to have an interdisciplinary team that's inclusive of a Simcoe County District School Board educator who's been with us since the beginning, a Simcoe County District School Board educational assistant, a social worker, a rec therapist, as well as consulting psychiatry and consulting psychology that will work together to help inform children's learning profiles, as well as how that adds to mental health concerns, as well as recovery. And then we've been very fortunate to also establish community partnerships with New Path, which is one of the main children's mental health providers in Simcoe County. The most important individuals on our team are the student and family, because this can be somewhat of a very intensive program, as students sometimes will haven't attended a regular school within 2, I think upwards to 4 years. So often coming into a high school environment or a learning environment can be quite cumbersome. So that motivation and willingness to participate, both from the family and the youth, are probably the most important part. Once we receive a referral, and I'll talk a little bit about the referral process a little bit later, but once we receive a referral, youth come in with their families and the referral source really to screen youth in. So we have a chance to do a biopsychosocial assessment and learn a little bit about what the youth thinks that they need in order to achieve their desired goal. Often for youth, this is that they want to return to school, and or they have an idea of what they want to do with their career. And sometimes it could just be that they want to learn more about their anxiety or low mood, or why it's so difficult for them in comparison to a family member, a cousin, a friend. What we're looking for in this meeting is really to find out how we can make this youth tick in simple layman's terms, and if our program will meet their needs. From the screening meeting, once youth are accepted into the program, they actually come for an orientation. And once youth are at the orientation, this really is a opportunity for them to meet the other youth, meet the treatment team, and also kind of start with some of those great rec therapy skills. At our orientation, we also have a chance that they get to meet with their educator and select their courses that they'll be working towards. When we are meeting with youth for our orientation, youth actually get to select up to 2 credits. We've been really fortunate. Our educator, Patty Grace, which she was in a picture earlier, but she asked me not to say that, meets with this student, and she's been actually to create really incredible programming where students are awarded a credit. It's called an IDC credit for their participation in mental health programming as well as attendance. So earlier when Dr. Montgomery and Dr. Hill were talking about behavior activation, using this as a motivation in order to get students to the program, to really focus on the habitual process and start talking about the importance of structure, routine, and predictability. Once students select their credits with our educator, our rec therapist and myself get to kind of start with goal setting and looking at referrals for community resources. We often have questions around right at the beginning, like how come we're already looking at community resources? I think it's really important to note that we're a 12-week program, and often we know that mental health expands across the lifespan. So really we're looking to build in that safety net for students right at the beginning. Our referrals are also brought in from the school level. So we're hoping that students are already coming in with a plan of safety to return and to start to think about our skills inventory post-discharge of 12 weeks, which seems like a lot, but goes quite quickly. At approximately week 6, we have something called a transition meeting. So by this time, youth have been in our program for 6 weeks. We have a pretty firm understanding of their learning needs, learning profile, mental health needs. And we have something called a transition meeting where we invite all stakeholders. So everybody that's involved in the child and family's care to come up with essentially like a business plan to get students back to school. And what this business plan typically looks like is asking community schools across the region, are you okay to have Johnny for the morning? And Johnny, what do you need to be successful that morning? This is what some of the strategies that we've learned help you at school. What can we do to also supplement that at school? So it's a really great way to have all community partners together to come up with a cohesive plan. And then after the 12 weeks goes by so quickly, we prepare for discharge. And it's quite interesting because discharge after the 12 weeks, we see about week 10, week 11, which we're in right now in our current cohort, that youth really are ready to set and go. So our 12 weeks is nicely timed because youth actually, after they've experienced mastery and autonomy, going back to their regular school and coming back to debrief at our VH program, that they're kind of ready to launch and they're ready to say goodbye. So at the time of discharge, students know who their academic point person is at school and who their academic point person is out in the community. Does anybody have any questions about the general? Okay.
Hi. I'm just wondering if you can create like a portrait of a person who might be eligible, just because I know there's a tremendous amount of children and youth that could, like from the criteria that I see, that would be able to perhaps get in. So I'm just kind of seeing as you only have 10 spots, I'm just trying to narrow down in my mind what that person might look like, what issues they might be experiencing in that. Like I get you're saying acute chronic anxiety and depression, but I imagine a lot of people meet that. Yeah. Is that possible?
Absolutely. Actually, thanks for the question. So our, I hate to say desired, but probably the youth that do the best in our program are almost like a hidden population. So they're youth that actually aren't known to the school. They're usually youth that are online learning. They have had several attempts to go to school and have had several attempts to engage with community services, like community mental health services, but haven't been able to follow through based on high levels of anxiety or low mood that have impeded their ability to attend. So often these youth will have a lot of avoidance behaviors. Oftentimes the family profiles will say, we just didn't know what to do, so it was easier for the student to stay home. But definitely with a primary diagnosis of anxiety or depression. Does that answer your? Awesome. Okay. So now that you guys have heard all the fun policies and procedures, or I guess procedures, I think it's really important to know how these youth move through the system, because it can be quite taxing. And right at the beginning, at the orientation meeting, we kind of go through all of this. Because I think that's also part of the process of, am I able to commit to this, and is this something that I feel like I will experience success? This is our daily program. So we actually follow the schedule as best as we can, knowing that there can be some interruptions. But really, the whole purpose behind having the schedule and following it is really to kind of follow along with some of the behavior activation principles that Dr. Montgomery and Dr. Hill talked about, and really starting into that habitual process. Oftentimes what we'll have youth describe to us is that having that schedule and understanding that they just have to make it to 10 o'clock and then they get to be on their phone for 10-15 minutes is kind of the saving grace. The other informal policy that we have at day program is that it's just come. If you can get there, that's our win for the day. And that's also our opportunity that we get to do our best work. So we have the schedule posted for youth, and oftentimes youth look forward to it. And also we use this as a corrective experience for youth as a trauma attachment informed classroom, that adults and individuals can be predictable and that will follow through. As you can see, we start our morning every morning with rec therapy. So I was asking about rec therapy a little bit earlier. I'm going to talk a little bit more about their programming, but we have specially designed rec therapy to start the day. Oftentimes, youth will start the morning and they will either report they're tired or they don't want to be here. So Rec therapy actually is our grab for students to get to demonstrate some of their skills and individuality and also learn other things that they're interested in. So in terms of therapeutic programming, we have both an Understanding Self group, which is a psychoeducational group by nature, and is run from a trauma attachment informed lens that talks about understanding our activations and maybe what's the purpose of anxiety in that moment, what are the feelings that are attached to it, what are our presentations of behavior, and what do we need from others. So we focus on the concept of the window of tolerance, the window of affect tolerance. Is anybody familiar with that here? Awesome. Which is Ogden, Siegel, and Levine concept. Really to embrace emotions and understand the spectrum of emotions that they're all emerging for a reason. So really trying to take holding joy, happiness, sadness, grief, and despair, all within the same lens. We often find that youth will come in and they'll report either hypoarousal or hyperarousal, and will almost have an absence of that middle window. So we really try our best to focus on name it so we can tame it, as well as understand what our needs are, both academically and from a mental health perspective from ourselves and from others. In our Understanding Self group, we also use this as an opportunity to investigate some parts work and looking at some of our behavior patterns that are really impacting us at home or at school in order to understand what they're protecting, and then build on our work in Understanding Self group to practice our skills in social skills. So this essentially is our way of having the knowledge and then doing it. We often find that youth will come in and they'll describe, I really need someone to listen. But then when we start to tease apart what is listening, youth really struggle to identify what that looks like. So we really, in our social skills group, really kind of build on the window of tolerance in terms of what are our needs, and then how can the people around us demonstrate those skills. When a teacher or somebody asks us when we're feeling anxious what we need, what can we tell them what we need, and then what can our action plan be for ourselves? We also focus a great deal on problem solving and role playing, which as soon as anyone says role playing, a whole bunch of eye rolls happen. I'm not going to make anyone do it here today, but it actually is one of the most incredible things about our social skills group, where we see youth come alive and are able to take on roles and demonstrate skills in a totally different context. So it's part of that bringing in some of the therapeutic arts that builds in rec therapy and gets demonstrated in other areas. Okay, so also part of programming, like I said, these are probably our two favorite groups and our most, the parent group being the most eye-roll group. But our rec therapy program really is to promote meaning and purpose. For youth, we really describe this as, as adults, work is our school, and for kiddos, school is your work. When we look at life, what are the things that bring you meaning and purpose? What are the things that your parents do that bring them joy? And how do we explore that for ourselves? So with rec therapy, often we use this as a way that youth can experience different activities in the classroom, plan events for themselves and their families, as well as really building quality of life measures for themselves. We also, throughout our timeline of treatment in week 6 and week 12, we have something called participatory days. And what our participatory days are they're rec focused, where youth get to plan a day for youth by youth. So they get to bring in all the different skills and practice that by planning a day for themselves. I think some examples of our participatory days is we've had like a cake-off, bake-off. We've had times where students have wanted to go and volunteer picking up garbage around the campus, creating cards to send to individuals who might be lonely or experiencing anxiety. I'm trying to think, sushi seems to be a big one that we do on participatory days, and go through all the skills in terms of working together, teamwork, and then finding things that we can do for fun that don't necessarily cost money. One of the really cool latency outcomes from rec therapy is this actually becomes a really nice area for youth to go home and share with their families. So oftentimes families will call and report and ask questions about, hey, can you send that cake recipe in? Or my youth did this the other day at school. How can I do that for my own family? So really also helping flip the script of the youth's capacity in their family and taking that to actually add to their family as a resource. Okay, parent group. So as part of our program prior to youth starting in our program, we have a parent group. The parent group is highly encouraged and really comes from the impetus of providing youth and family with the same shared language. Also with this, we put a plug-in to connect with different community resources and to support service navigation for families and psychoeducation, that mental health just isn't an individual focus, that it actually extends across the family and community. So some of the topics that we cover in parent group are definitely trauma, attachment, safety planning for the community, safety planning in general, parenting with mental health in mind, and then also putting the plug in for parents to make sense of their own experiences and how it influences them as a caregiver. Any questions about our programming or concepts? No? So, shamelessly, we have some student perspectives. I always smile at these because on our last day of part of our Understanding Self and Social Skills group, when at week 12, we asked students to write themselves a letter, like a day one self letter, to pass on to the new cohort that comes. Students are allowed to embrace the rec therapy skills that they've learned, and they can present it in any way they would like. With permission, both students from our previous cohort said that I could share these so I'll just give you guys a second if you wanted to read them out. Or I'll read the first one because you'll learn a lot even if it isn't coming directly from the course, just the interactions with peers and staff. I think you'll come out a different person, maybe not better, but for sure with more understanding of why you are the way you are, and that it's a very individual process. And the last one, when I first decided to attend day program, I was riddled with anxiety. I was terrified of being in a place where I had to engage with total strangers, talk about my feelings, and participate in activities I didn't want to do. I was lacking in confidence and struggled immensely with opening up about myself. That fear subsided in a week as I became more comfortable with routines. I learned not to be afraid and embarrassed to speak up about myself and for myself. I gained confidence in myself and my skills, as that confidence was always inside me. It just needed an opportunity to let itself out. Okay, so how to refer to our program. Our referrals predominantly come from Simcoe County District School Board, based on being a dually funded collaborative program. Referrals are accepted from the school board. Often we'll get calls from family physicians and family health teams inquiring, how can we make a referral? We ask that you connect with either the school social worker or the school psychologist to help support a referral at that school level, really starting with that early resourcing and skills resourcing for discharge. If anybody wants to access a referral package, by all means, please feel free to email us or contact us, and we can make sure that we have get you that referral package. I also have some pamphlets here at the front with the same information for referral. Sure.
So with it being the Simcoe County District School, oh, sorry, I just saw the answer to my question. There's the Catholic School Board as well. Okay.
Absolutely. Yep.
So both school boards.
All school boards, actually.
Okay.
All across the land.
Okay. Thank you. Sorry about that.
The region, sorry. Absolutely.
What is the wait list?
So, great question. Our wait list is, we have 3 semesters per regular school year. Right now, for our upcoming semester, it's full, but we do not have a wait list for our 3rd semester.
Great.
So, just as a last, how are you doing for time? Sorry, so just for our last, kind of in conclusion, our program is quite new. We're still in our infancy stages of learning, developing and redeveloping, and trying to bridge gaps as they come. So some of the learnings that we've had simply are really the importance of good psychoeducation across the lifespan. So speaking very much to Dr. Hill and Dr. Montgomery's presentation earlier of the importance of having psychotherapy available and for both families and youth. The other thing that we find the most important and to explain is that there's only strategies and not solutions for mental health. Something that might work for us at week 1 might not work for us at week 12 or week 14. So really getting that tool belt together and not expecting something to work every time. But also using some of those successes and wins to reflect on what can help us in the future. We've been very fortunate to have very valued and dynamic relationships, both with Simcoe County District School Board and Simcoe Muskoka. They have been pivotal in supporting our transition plans because they're quite unique to each student and can be very cumbersome in terms of labor intensive, checking in with students and going the extra mile. We also have an MOU, a memorandum of understanding with NewPath we've created a dynamic partnership that helps support where our program falls short. So being very realistic, we are located in a primary healthcare setting, and often these youth need help out in the community or prior coming to program. So we've been able to partner with NewPath IST to come up with a program that's specific to the gaps and bridging gaps. The other learning is the importance of rec therapy and specifically using this as a mental health strategy. It really helps support focusing on youth skills, transferable skills, and the exception to when the mental health concern does not exist. We also use information from rec therapy to help support with state changes and understanding how in one scenario we can feel lots of pride, mastery, autonomy, and independence, and how can we use those skills to move them over. The other value add that we've really recognized is the importance of building community into the process, as well as really valuing those relationships and having that transparent communication in terms of our working relationships. Our program wouldn't be as successful or move as smoothly if we didn't have those valued community partnerships with NewPath, the Gilbert Center, Simcoe Muskoka Catholic District School Board in Simcoe County. So that's kind of been some of the significant value adds, and always looking to collaborate and share resources and information. So I know there's other programs out here today. I would love to say hello, meet and greet, and hopefully have the pleasure of sharing a patient one day.
Excellent. Any questions? Oh, we have a couple here.
Just understanding how the process works. So if a student was in school and then they came and did the 12-week program, do they still also try to attend the 4 classes or 3 classes that they're in to continue that in for when they're finished the 12-week?
So academic planning, I have to be quite transparent, is our educator is the expert in that. However, I can speak to generalities. Students work towards 2 credits in our program, an IDC credit and a credit of their choice that can be facilitated in our classroom setting. So often youth who are coming into our program do not have any credits that they're taking, or they could be working on 1 or 2 credits, or have some credits that are at risk. What our educator typically does is does a skills inventory, an academic inventory, and we'll build that in. So we have youth in our program that have either achieved 2 credits and some youth that have achieved up to 5 based on that individualized education plan.
That makes sense. This kind of makes me hopeful that one day we'll have a course in school for all kids to take on mental health, that the board can pull something from what you're doing to allow kids that opportunity to understand mental health better.
That would be amazing to have that course. Yeah, thank you.
Great. Any other questions? Certainly, I took note of your final slide where it mentions about community building and resources that are currently in the community. And so obviously we are all considering the fact that there are only 10 spots. And what do we do when we know there are patients on the other side of Collingwood? So we're still another 40 or 50 minutes away from being able to be transported there, even if we were able to get in. But your points around the rec therapeutic programming that could currently be available, that life skill piece that you actually identified in the calendar of events, but also on that list, really showcases that there are community-built programs to support individuals in communities that we can access now. And even yesterday, a portal opened for one of the largest organizations serving youth in rural Ontario, and that's 4-H. And if you look at those life skills, they are all delivered through those programs that we took in 4-H. So I would encourage, for those of us that are looking for hope in the midst of hopelessness, for those of us that are looking for resources when we don't necessarily have access to those top 10 spots, what can we be looking for again, and how can we build out some of those Scouts programs, some of the programs within the youth groups that are functioning within the community, and some of the traditionally built, and now they have, 4-H has put online a lot of their curriculum so that you can access and deliver that even in your local family health team. So thank you for that presentation, Mary. That was excellent.
Thank you so much for having me.